Hi, friends, welcome to our channel. I'm Aretha Moore. In today's video we will talk about coronary artery heart disease, its causes, symptoms, and at the end of the video, we will also talk about the possible treatments of coronary artery disease. So keep watching the video till end. Coronary artery disease is a serious heart disease that affects both women and men. The coronary artery is one of the most important arteries of the heart, as it provides the heart muscle in the appropriate amounts of blood needed by the muscle. It helps to nourish the heart with oxygen and nutrients. The coronary arteries are a branch of the aorta in the heart. There are two types of coronary arteries, the right coronary artery, and the left coronary artery. When a coronary is exposed to deterioration, dysfunction or impairment of its vital functions, it causes significant damage to the heart muscle, and thus many serious complications occur on the patient. Through the following lines, you will know with us dearly detailed on the disease of coronary insufficiency, and the causes of its symptoms and symptoms, to buy with us. What is coronary artery disease? Coronary artery disease joins the list of serious heart diseases, as it leads the most serious diseases in the United States and suffers from more than 13 million Americans. According to what they describe as the first deadly disease in America, coronary artery failure occurs when hardening or blockage occurs in the coronary arteries, which in turn feed the heart muscle with oxygen and nutrients and supply blood to it. Cholecystectomy occurs as a result of the accumulation of many cholesterol-laden plates, with many deposits of fatty substances, reducing the flow of blood to the heart. This arterial blockage also leads to narrowness in the blood vessels and veins that supply the heart itself with the desired blood. Causes of coronary artery disease. 1. Obesity. A serious complication of obesity is that it is one of the main causes of coronary artery disease. This is because the amount of fat accumulated in the body lead to atherosclerosis significantly, as fat and fatty substances form some deposits on the walls of blood vessels. There are also some chemicals that accumulate on the walls, which makes fat, and these substances form the substance of the platelets that cause severe blood clotting and clotting. This leads to accumulation in the damaged part of the vessel wall. Here, a narrowing of the bloodstream and a blockage of the blood vessels occur. 2. Frequent smoking. Smoking is a very harmful habit to human health, but one of the most damaging is that it is a major cause of coronary artery disease. This is because the tobacco substance in cigarettes is sufficient to cause inflammation of cells that pass through the blood. This inflammation leads to blockage and hardening of the arteries and narrowing the blood vessels to the heart, and ultimately lead to a reduction in coronary artery function by providing the heart muscle with appropriate blood. 3. Stress and diabetes. Causes and factors that increase the risk of coronary artery disease: high blood pressure levels, and high blood sugar levels, where both work on atherosclerosis and reduce blood flow to the heart muscle. Symptoms of coronary artery disease. Inability to breathe. There are many symptoms and signs associated with the patient of the coronary artery, the most important of which is severe breathlessness and a feeling of suffocation, with the feeling of pain is unlikely in the chest area, as a result of the accumulation of fluid in the lungs. Sudden fainting. Symptoms of coronary artery disease are sudden fainting and sudden heart attack. This increases sweating greatly, especially during a simple physical effort. Swelling of the body. It is also signs that occur as a result of arterial blockage and weakness of the heart muscle are swollen and inflated body parts such as hands and feet. Treatment of coronary insufficiency. Aspirin therapy. There is more than one way to treat coronary artery disease with drugs and medical drugs. The most important is the use of aspirin antiplatelet aggregation on the walls of blood vessels, which reduces the incidence of a heart attack by 34%. If you have an anti-aspirin or a gastric ulcer, take an anticlopid and a grill. These antibiotics reduce the reduction of the risk of a stroke of the artery. Treatment with inhibitors. One of the most common treatments for coronary artery disease is the use of beta blockers, which are most beneficial to angina, or S inhibitors, which improve heart function, reduce muscle hypertrophy, and reduce arteriosclerosis. Friends, we hope you find this video very helpful to coronary artery disease. Like and share it with your friends and family so they can also take benefit from this video. Thanks for watching. Have a good day. Disease. Like and share it with your friends and family so they can also take benefit from this video.